I'm honored today to introduce our speaker, Dr. David Thompson, who is a cardiologist and board-certified lifestyle medicine physician. Dr. Thompson is local. He grew up in Westchester, Illinois, and attended Benedictine University, where he graduated magna cum laude on a piano scholarship. Despite his interest in music, during college he took a hospital practicum course and then decided to become a physician. He attended Loyola University Medical School and completed a residency there in internal medicine in 2008. While at Loyola, Dr. Thompson found the diversity of cardiovascular disease and advances in treatment options exciting. So he remained at Loyola and completed a cardiology fellowship there, along with advanced training in cardiovascular imaging. As his career continued, a new passion for lifestyle medicine emerged after reviewing evidence-based research showing a way to help prevent and reverse chronic diseases like heart disease. As a board-certified lifestyle medicine physician, Dr. Thompson utilizes lifestyle medicine in treating patients with cardiovascular disease. So please join me in giving a very warm welcome to Dr. David Thompson.
Thank you, Tim. Thank you. Good afternoon, everyone. Thank you, Tim, for that kind introduction and for all of you being here to attend this talk. And I appreciate the Science of Spirituality for inviting me. They've been wonderful hosts. Such a magnificent building and place this is for the community. And I really appreciate them inviting me here to speak to all of you today about this very important topic of heart disease and how we can prevent it. And why is heart disease so prevalent? Has that been discussed as far as your diagnosis goes with your healthcare team? Did anyone ever bring up, well, why do you have these blockages in their heart? Or why did you need a stent? Why did you need bypass surgery? Usually, the answer to that is no. Usually, we go to the doctor, we get diagnosed, we go through a battery of tests, we go through procedures, we get put on medicine, and we say, well, things look good. Heart's in good shape, you're cured, we'll see you in a year. But that approach is not really working well. Heart disease is so prevalent, we're seeing more and more chronic diseases develop, and that approach to healthcare, I think, has something lacking that we'll go into as we go on with the talk. So here are a few areas in the world where there is an absence or a very near absence of the disease that we're speaking of. The people in these cultures do not have blockages in the arteries and need stents and bypass and hospitalized for chest pains. So is it something in our genetics? Because we're told a lot, well, what's your family history like? Well, my mom had her dad or siblings, so it must run in my family. Well, that's what oftentimes we're led to believe. But is there something here in people in these types of regions that is protecting them? Do they have all these magnificent genes where they don't get heart disease? Well, that's one theory, but I think we'll go into a little more detail and figure that out in a little bit. These are heart disease death rates in the United States. A lot of red areas. So if we think about, well, is it family history and genetics? Well, is there something wrong with our genetics in the United States? Why this is so prevalent in our area, but not in several other areas of the country? Something to think about. So it's the leading cause of death among both men and women Any idea how many people die every day of heart disease in the United States? Anyone want to shout out an answer? 7. We wish it was that amount, but it's almost 2,000 people die every day of heart-related diseases in America. It's about 1 in every 30 to 40 seconds. So this is a case that I just wanted to go over. Typical patient we might see in the office. Mr. Jones, 64 years old. He has pre-diabetes, almost diagnosed with diabetes, borderline blood sugars, little high cholesterol, little high blood pressure, little overweight, eating foods that are standard among our diets with some fast food and some red meat, some cheese, dairy, snacks, ice cream, few beers on the weekends, doesn't exercise too much. And he's tried a lot of diets over the years without any real long-term success. But he feels fine. He does not have any symptoms of heart disease whatsoever. He may go to the doctor and say, I feel fine, there's no symptoms here. Great. What is his risk of developing a heart attack or stroke in the next 10 years? It's an interesting question. That's what doctors think. We think, what is the risk in this person going forward? 5%? 12%, 18%, 22%.
22.
Oh, we got someone for 22%. That is the correct answer. 22% risk. Excellent. So, what would have the greatest impact on lowering his risk of heart disease? What do we think? We have a lively crowd with a lot of good answers here, particularly from this area of the room. So should we add more blood pressure medicines to get his blood pressure better? That sounds reasonable. Should we add more cholesterol medicines because the cholesterol is a little high? Should we tell him to exercise because he doesn't really do much? Should we decrease his alcohol use? Should we tell him to eat better? Or should we do a little combination of both? Should we tell him to got to get on a couple different meds here, or start exercising, decrease your alcohol? Maybe just a combination. What would have the greatest impact? E would. We're going to come back to this question at the end, okay? So we'll find out what the real answer is there. So chronic disease prevalence is at an all-time high. We know this in America, and it's on the rise significantly. 6 in 10 adults have a chronic disease. 4 in 10 have 2 or more. Half of all deaths in this country are related to heart disease deaths. And by chronic disease, we're talking about the non-infectious diseases. So chronic disease in medicine, we think about heart disease. We think about high blood pressure, we think about diabetes, we think about obesity, kidney disease, dementia, all of these things that are more along the lines of chronic. So it's well documented that we spend a lot of money on healthcare in the United States, and we are an outlier when it comes to that from almost every other country. So you may wonder, well, why is the disease so prevalent? Why do we have so many people with heart problems, but we're spending all this money to tackle these problems? But chronic disease is on the rise. This is an interesting question, right? We should be looking at this. Our avoidable death rates are the highest also of any other country. So we spend the most, but we're not getting the results we would expect. And you could see that little spike towards 2020 was COVID-related deaths. Higher here than many other countries, and that's attributable to risks, our lifestyle risks, our heart disease risk, high blood pressure, lung disease, kidney disease, and so forth. So these are the main, not all, but many of the major risk factors for developing heart disease. High blood pressure, diabetes, smoking, cholesterol, leading sedentary lifestyle, high amounts of alcohol. And these are the things that lead to blockages in our arteries and clogs them up. But the good news here is, if you look at all these risk factors, we have some control over all of them, all of these things. We have the power to influence every single one of these. So people will oftentimes say to healthcare teams, we're worried about the heart disease risk, it runs in our family, etc. We're worried about me maybe having a heart attack one day, and what can I do to stop this? Well, and then we go into the reasoning behind why that is, and that's oftentimes because we're eating a diet in America that looks like this. This is contributing to chronic disease in our country because we call it the SAD diet, or the standard American diet. The food that we are taking in, as it turns out, is the culprit leading to many of the chronic diseases that we treat. And so they've studied what would happen if we change our diet around, and we'll get into that in a little while. But this is something we need to focus on, is what are we putting in our bodies every day that may be contributing to our disease later in life. This is the standard type of foods that we'll have, right? A lot of refined grains, a lot of heavy oil, fried, sugar, sweetened beverages, high saturated fat, high processed foods. Not a lot of healthier foods on a regular basis that we're consuming, such as fruits, vegetables, whole grains, beans, legumes, and the like. So the World Health Organization looks at these foods that we're eating and classifies them into certain categories. Processed meats, such as sausages, hot dogs, bacon, pepperoni, salami, things that we see out there every day, the World Health Organization studied this and classifies them as a group 1 carcinogen, meaning that there is evidence to show that it causes cancer, particularly GI cancers like colorectal cancer, prostate. So these are the types of foods that we see that oftentimes we don't think much of, but over time contribute to our diseases, right? And nobody really tells you at fast food stores that what we're serving you potentially is going to lead to cancer down the road, but indeed that's what the research shows. Red meat is classified as a class 2A carcinogen, which means it probably causes cancer. And for our reference, those are some other group 1 carcinogens that we probably don't want a lot of either. Ionizing radiation, asbestos, those are in the same category as processed meats are. So as I mentioned, many of the chronic diseases are driven by unhealthy lifestyle. These 4 are ones to focus on: tobacco use, unhealthy diet, physical inactivity, and excessive alcohol use. How many of us are actually following the rules of trying to live a healthier lifestyle? Well, according to Mayo Clinic, a whopping 3% or less of us are doing those 4 things. Exercising, eating relatively healthy, relatively normal body weight, and not smoking. Less than 3%. Well, I think we can do better than that, and the research shows that indeed we can get better results if we try to do better than that. Here is a study from Sweden looking at middle-aged men, over 20,000 of them, and followed them for years looking at their lifestyles and does that impact their risk of heart attack down the road. And what did they find? About 4 out of every 5 heart attacks may be preventable simply by doing those things: eating a healthy diet, moderation of alcohol, not smoking, being active. 4 out of every 5. And that goes along with also the World Health Organization that states 80% of heart disease, stroke, and type 2 diabetes is preventable and would disappear if we led healthy lifestyles. 40% of cancers would go away. And many of these numbers people think are a little bit on the conservative side, actually. When you look at some of the studies, it may even be a little bit higher than that. So why aren't we doing this? That's the question, right? So our American College of Cardiology and all host of medical guidelines will support lifestyle interventions, changing lifestyle when we have a diagnosis of chronic disease, because it will impact you positively going forward. So all of our treatment strategies lead with lifestyle changes. So why aren't we doing it? Well, one of the problems is most of the doctors and clinicians have not been trained to deliver effectively on these interventions, believe it or not. In medical school and training, there is not a lot of time spent on prevention and lifestyle and how you can support patients in that endeavor towards a better health trajectory. What we do spend a lot of time on is this: This is a cartoon. I think if you remember nothing else from this talk, this cartoon is what to focus on. We, meaning healthcare, are too busy mopping up the floor to turn off the faucet. So this is us, our team of doctors and everybody coming in to fix up the floor when someone is acutely ill, right? And we're pretty good at that. We're very good at people are coming in sick in the ER, having a sudden heart attack. We can fix them up, patch them up, and send them on their way, and everybody's happy. But the problem is that faucet in the background is the root cause of why they were there to begin with, and nobody's looking at that faucet going forward. So that faucet keeps running. Here we are coming in, mopping up the floor again. And that happens time and time again. So what about genetics again? So remember this thing, well, hey, that all sounds good, but what if we just have bad genes, right? Isn't that part of the problem? Well, this is a busy slide, but I would focus on the highlighted parts here. This study looked at the influence of our lifestyle for a given genetic risk. They took what's called polygenic risk scores of patients to divide them up into what we consider high-risk genes, moderate-risk genes, or low-risk. And they looked at people that had low-risk genes on the top left, and did they lead an ideal lifestyle, and how many years did they live, and did they develop any heart disease? Well, the average age is mid-80s if you have low-risk genes and you live a pretty good lifestyle, which is great. So what if you have pretty low-risk genes and you lead a poor lifestyle? As you go downward on that left side of the diagram, you could see in red, your lifespan now all of a sudden drops into the 70s, the low to mid 70s. But you had relatively low risk, what we consider lower risk genetic markers. So down the bottom left, high polygenic risk score. If you lead an ideal lifestyle, look at that. Your genetic risk is high, but if your lifestyle is good, you're living approximately as much as someone who has low-risk genes. And now the real kicker here is down below. So you have high-risk genes and you're leading a poor lifestyle. So now your lifespan is really down to the 65 to low 70 range. So that's the impact that you can have on your genetic risk. And that term we call epigenetics. Epigenetics is what that graph shows, is what is our lifestyle doing in conjunction with our genes. And it turns out a lot of these genes are in the background kind of watching. They're not doing a whole lot, but when our lifestyle or a poor lifestyle interacts with them, a lot of these genes can get turned on and become expressed more. And that's what leads to a lot of unhealthy chronic disease. So that phenomenon is called epigenetics, is well known. As what they say is genetics may load the gun, but our lifestyles pull the trigger. This was a 10-year study looking at heart attack risk, again, in people that had high-risk genes. They led an unhealthy lifestyle versus those that led a healthy lifestyle. And as you can see, your risk dropped about in half. Just with leading a healthy lifestyle alone, your risk is decreased significantly. This was a study called the InterHeart study, a famous study many years ago that looked at tens of thousands of people across dozens of countries and tried to figure out what are the lifestyle factors that lead to heart disease. It's all of the ones that we've been talking about. Abnormal cholesterol, smoking, high blood pressure, diabetes, overweight. Psychosocial factors, which play a role too, are stress and chronic stress. Consumption of fruits, vegetables, alcohol, and physical activity. And when they looked at all those risk factors, that accounted for 90% of the population risk among men and 94% of the risk among women. And this is it showing in graphic form here on the bottom. As you rack up more and more lifestyle factors, the odds go up and up and up of you having a heart attack. When they look at family history, though, right, that was part of what they were looking at here. After they took into account all of these modifiable risk factors, they said, well, how much does the family history play a role? 1%. 1% extra. What about cholesterol? So we hear a lot of things about cholesterol. Oh, it's not so bad for you, right? Our bodies need cholesterol. It's okay to take in some. Well, this graph shows what your risk of having a heart attack is as you age, depending on your level of LDL cholesterol. So that's the bad cholesterol that we measure. So in that blue line, it shows if you have about an average level LDL, which is about 125 in America. If you screen people, that's about the average. As you age, if your LDL cholesterol stays around that level, even young age, middle age, your risk of heart attack on that blue upper line is going up at a higher rate than if your cholesterol was lower early in life. So the lower you get your cholesterol, the better it is. The sooner you get it down, the better it is. Because by the time you reach age 60, 70, if you've been exposed to that high amount of LDL cholesterol for the majority of your life, your heart attack risk is somewhere in the neighborhood of 6 to 8% versus someone who might have had a low cholesterol most of their life. When they get to be 7 years old, the risk is still about 1%. So how much cholesterol should we have? Well, USDA dietary guidelines say eat as little as possible. As little as possible. They don't give a limit to we should have this amount or don't go over this amount. They say eat as little as possible. And where do we get our cholesterol from? Well, we get it from our diets. Dietary cholesterol is only found in animal products, only found in foods that originate from animals. We get it from saturated fat, which eventually gets turned into LDL cholesterol. Again, predominantly found in animal products, in our diets, particularly high-fat dairy and meats. And we get it from trans fats. Here are some examples of foods with saturated fat. All the foods we know very well that we can easily obtain on our local corner fast food store. Here's the amount of saturated fat. Cheese, of course, is a big one. Red meat. Chicken, white meat have some, albeit less. And down towards the bottom are some of those tropical oils that are hidden in a lot of packaged and processed foods. Significant amounts of saturated fat in those. So reading the labels is something we ought to get more accustomed to doing, particularly looking at the saturated fat level of what is in the food that we're eating. And avoiding some of these foods will do our cholesterol a lot of good. So what else is causing this heart disease? So we know cholesterol, saturated fat, helps to clog our arteries. Well, this was interesting. This studied something called TMAO. The technical name is triethylamine oxide. But it turns out that omnivores have a bacteria in their gut that after they eat, it gets fermented to TMA, goes to our liver, gets oxidized into this TMAO substance. That does all kinds of deleterious effects on us, including developing of blockages in our heart attack risk, metabolic syndrome, type 2 diabetes, progression of kidney disease. The inflammatory cascade is going full steam ahead here when we eat something like that. So the risk of heart disease increases with more inflammation, right? This was a study in our journal, American College of Cardiology, looking at dietary patterns and inflammation, right? Because part of our blockages is inflammation. That's part of why we develop heart disease and clogged arteries. And it turns out inflammation increases with intakes of red meat, processed meat, refined carbohydrates, sugar-sweetened beverages. Those inflammatory markers that we can measure go up. And on the bottom, you could see the more inflammation you have, the higher the risk of heart disease. What lowers the inflammation? Well, that's in the green box there in the top left. Those great healthy foods that we mentioned, green leafy vegetables, fruits, whole grains. What do our guidelines say? Well, these are prevention guidelines from the American College of Cardiology. And what they say is dietary patterns associated with higher cardiovascular mortality include sugar, low-calorie sweeteners, high-carb diets, low-carb diets, refined grains, that's all the processed foods and desserts and packaged foods, trans fat, saturated fat, like we mentioned, high sodium, red meat, and processed meats. So you might say, well, what else is there to eat, right? There is a lot. There is a lot. So that's right from our guidelines of what we should be eating is more plant-predominant dietary pattern. And that's the pattern that we see time and time again significantly lowers the risk of heart disease. So concentrating on high amounts of beans, chickpeas, lentils, fruits, vegetables, whole grains, all of those things that are naturally occurring and made from plants is what helps protect us. The increased availability, affordability of high-calorie foods and our decreased physical activity and our sedentary lifestyle is fueling the disease epidemic in our country. So these are the types of foods, right, that we should be consuming more of. In general, the more colorful your plate is, the healthier it tends to be. Lots of antioxidants, and dietary causes are the leading cause of chronic disease and disability, right? Look at that, higher than many other risk factors. And that's not because these other ones are not important, it's just that an unhealthy dietary pattern is so prevalent in our country that it ends up being the leading cause of chronic disease and disability. But there is hope for us here. The American College of Lifestyle Medicine, of which I'm a part of, was started about 20 years ago because they saw a need for what are we doing with this chronic disease epidemic that we're seeing, right? We have all this great technology, all these pills and procedures. Where is it getting us? Not as good as it should. So that's where this organization came in. And they focus on 6 pillars of health: nutrition, physical activity, stress management, social connectivity, restorative sleep, and avoidance of risky substances, particularly tobacco and excessive alcohol use. And they, in their research and in evidence-based, they go on to say that really lifestyle should be the critical first-line treatment for these diseases, not take this pill, take that pill, and I'll see you in a year and we'll see how it goes type of thing. The disease in the background is going to be progressing if you don't get to the root cause of why it's there in the first place. This is their website if you ever wanted to go to lifestylemedicine.org. But these are evidence-based approaches based in science. These aren't people there just saying, well, I think this and my opinion is that. No, this is based in true evidence and true science. So eating plants, moving well, sleeping well, being present, staying calm, and staying connected and loving others is what the pillars focus on. So as I said, the epidemic in America is ever growing. We spend $4.1 trillion annually on healthcare. 90% of these costs are attributable to pills and procedures. So what lifestyle medicine does is, again, try to address the root cause. Why is the disease there to begin with? This was one of a landmark study called the Lifestyle Heart Trial, done by Dr. Dean Ornish, who many of you may have heard of, out in California. He was consulted when President Clinton had his heart issues. They actually brought him into the White House to change his diet around and stop having him go to McDonald's and all those things. But one of his trials that he did looked at people that had heart disease and had blockages in their arteries. And he divided those people up over time to intensive lifestyle therapeutic measures, getting them eating healthy, giving them social support, getting them exercising, managing stress. And then the other people just got the usual care, usual medicines, seeing their doctors like they should be. So the usual people are the red lines. They looked at their blockages a year later, 5 years later, and the percentage of blockages in their arteries is going up. The usual care, folks, right? They're on the medicines, even those statins. Some of them were even on statins back then, but their blockages are increasing on average. Now, on the bottom, in green, those are the people that were in the intensive lifestyle program that Dr. Dean Ornish put them through. And they looked at their blockages over time, and their percentage of blockages in their heart was improving over time. Improving. The percentage of those blockages were getting better without putting stents in, without giving them more pills. So that was one of a landmark trial that said, something else is going on here. This study looked at people that almost had diabetes. They had pre-diabetes, and they put them on our usual pill, metformin, that you've heard of, and they said, well, some people can get the pill, some people can get placebo, some people can get an intensive change in their lifestyle. And we follow them and see, are they going to develop diabetes or not? Well, it turns out a 58% reduction in diabetes was seen with just lifestyle changes alone. It was almost twice as effective as the pill. This was also a study with looking at patients that had diabetes. 4,500 people, again, randomized to usual care with pills and following up with doctors and dietitians, and then putting them through really focused support and lifestyle interventions and changes. And what did they find here? Well, the people that had the lifestyle changes were extremely more likely to have greater physical fitness. They lost more weight. They were more likely to experience partial or even complete remission of their diabetes. So let me say that again, remission of diabetes. We don't talk about that much, but it does exist. When you have diabetes, it doesn't mean you necessarily have to live with it and the disease progresses. You can put it into remission, and that was shown here in this paper that shows it actually can occur with intensive lifestyle interventions with similar success as bariatric surgery, but of course with fewer side effects. There aren't many side effects in eating healthy. So here on the left, you can see all of the unhealthy behaviors. That leads to changes in our microbiome, the epigenetic changes that we mentioned, which impact our gene expression, and direct cellular injury. All that leads to inflammation, which ultimately leads to all of these chronic diseases. We have to do something to decrease that inflammatory response in our bodies, particularly in our blood vessels. So you could think of inflammation like a fire going. It's brewing in the background, and it can go on for years without you even knowing it until it's perhaps manifest too late. But the inflammation that comes from our lifestyles, namely animal foods, a lot of high saturated fat and oil, refined carbohydrates, saturated fat, tobacco, desserts, pizza, cheeseburger, hot dogs, all those things that are so prevalent. What will decrease inflammation, though, are fruits, vegetables, beans, lentils, whole grains, all kinds of those healthy, whole food, plant predominant type of dietary pattern. We need to do something better to preserve the lining of our arteries. So on the left, you could see a real healthy blood vessel. And if you could see it in the back, inside the very center there, along the edge, is a tiny, tiny red layer. That is the endothelial layer that lines every blood vessel in our body. It's one cell layer thick. When we ruin that layer by the pizzas and the hot dogs and the cheeseburgers and the milkshakes, everything gets stickier. Your LDL cholesterol that is in there gets sticky. All those cellular elements get sticky, and it erodes into the wall of the artery, and that sets up a whole inflammatory cascade that leads to all of that clogged artery that you see there on the right, with just a little bit of tiny blood flow flowing through the center. So we have to do everything we know of scientifically to preserve that endothelial lining of our blood vessels. That's key. So you may have heard of Mediterranean diet, right? So people say, well, Mediterranean diet I heard is healthy. What about that? Well, it is healthy. Mediterranean diet does incorporate, some animal products with it, a little bit of dairy, a little bit of chicken, mostly plant foods, though, predominantly. But they studied that against a controlled diet where people were eating a lot more animal products, and indeed it was better. So as you can see there, those are heart attack, stroke, dying risk, and those are the lines. So the controlled diet that line was going up a lot steeper than the Mediterranean diet was. So yes, it can be a healthy diet. because it was better against a control diet. But what people don't talk about much is those lines are both going up. We don't want that line going up, right? We don't want it to go up much at all if we could avoid it. But it's going up at a less steep incline, but yet it is still going up. So what we call it is the residual risk, right? There is still some residual risk there, even with a Mediterranean diet. So we don't want that, right? We don't want any risk if we can avoid it. So how do we get there? Well, you may have heard of Dr. Esselstyn. He is a surgeon originally, worked at Cleveland Clinic, and he studied how nutrition impacts our vascular health back in the 1980s and 90s, when not very many other people were looking at this. But he thought there's got to be something more to the story here. And so he published this paper, A Way to Reverse CAD, which is coronary artery disease. So I got to say, as a physician going through training, myself, other colleagues, we aren't taught that coronary artery disease can be reversed. But yet, indeed, the data shows otherwise. He took almost 200 patients that had significant heart disease, blockages. They've had many stents, bypass surgery, maybe some of them even 2 bypass surgeries, and their disease was progressing despite all of modern medicine, to the point where their doctors said, well, there's not too much more we have to offer. So he took some of the sickest of the sick at the time, and what did he find? Well, he put them on plant-based nutrition, first of all. He said, let's change your diet around, get rid of all of those standard American dietary patterns that we've come to know. So what did he find a few years later? Out of 177 patients that followed the diet, there was 1 person that ended up progressing their disease. 1 out of 177, which was remarkable. Here are some of the pictures looking at before and after pictures of their arteries, blocked arteries in their heart, before and after they changed dietary habits and lifestyle. You could see how the blockages were improving. Down in the bottom left is a nuclear scan of the heart showing where there is lack of blood flow in the dark area, but then afterwards the blood flow is filling in and improving, just with changes in what we're eating. This was not putting stents in, this was not giving them more pills, putting them through another bypass. This was just changing what we eat. And the heart is responding by improving the blood flow quite significantly. So what is his residual risk in this study? Well, you can barely see it, right? It's way down there at the bottom. Not much risk of heart attack or strokes when you're just changing your diet around. So your risk was dropped significantly. So you might say, well, how do we do this, though? That's really hard. And it is really hard, right? It's not easy to change our lifestyles, for sure. And it can't be done overnight, right? It's got to be a process. But some of the things you could think about are the following. These are ways you can maybe increase your healthy dietary patterns, right? And one of the ways I tell patients is, if it's too much to think about changing things right away, maybe think about adding things to your diet first, before you even think about eliminating, right? That can be a little easier on the brain to take. I'm just going to add in some of these things to start and see what happens. So you add in fruits and vegetables, beans and whole grains, which, by the way, have a lot of fiber. We are not taking in as much fiber as we should, and fiber helps with our gut health, helps with our heart health, cholesterol health, and using water or vegetable broth in place of beef broth or heavy fat oils, that can be helpful. Whole grain bread, sourdough bread, as opposed to white breads. Using almond, soy, oat milk. Oatmeal for breakfast, probably one of the healthiest things you could have to start the day, right? And you could put all those healthy things on there. Fruits, walnuts, berries, flax seeds, which have a lot of good healthy fats and protein. Nutritional yeast is an ingredient that can be used in various recipes to replace cheese, that is. Mexican, right? Who doesn't love a veggie burrito, right? That could be something you could think about doing. You take out the beef, but put in all the other good stuff. And even using pasta, like whole grain noodles for pastas instead of high amounts of flour and white flour. So those are the types of foods, right? So there's a lot of different websites you can go to in your handouts where you can get some ideas of things. Because honestly, when I first started learning about this, I said, well, what am I going to eat? Lettuce and carrots all day? Right? There's a lot more, though, to it. And you can go to these websites and you can look at some of these recipes and pictures of foods and see what you like and what might be appealing. Even desserts, right? You could even do desserts this way. So what about weight loss, right? We all want to lose weight, but that should not be the focus in medicine. We shouldn't say, well, how are you going to lose weight and do that quick? That's not getting us anywhere. But if you eat a dietary pattern like this, you will lose weight by default. And that's partly in principle to this principle called the caloric density. So if you look, this is what 500 calories looks like in our stomachs. So as you can see on the left, if you eat some oils and cheeses and things and meats, that 500 calories doesn't go very far in our stomachs, right? We're still hungry. We still want more. We still want the chips and the soda and the desserts. But if you go on the right and you eat more whole food plant predominant nutrition, that 500 calories comes very close, if not fully, to filling up your stomach. So by default, you eat this way, you take in a lot less calories, you end up losing weight. So a few questions, though, always come up, right? Don't I need milk for calcium, for my bone health, right? That is a complete myth. You don't need milk for calcium and bone health. You can get calcium from whole food plant-based nutrition. And then, of course, the big question that people that are wondering is, where do I get my protein from? You most certainly can get enough of your body's protein needs from plant-based nutrition, and that's been studied time and time again. Beans, lentils, peas, nuts, even some grains like quinoa and farro, you can get all the protein and more that you need from that type of dietary pattern. And remember, there is no fiber in animal foods at all. Zero fiber. You only get fiber from plant foods. You only get cholesterol from animal foods. So there's no cholesterol in any plant food. The only thing you'd have to think about if you really said, gosh, I'm going to try to do this and not have many animal foods in my diet, the only thing you'd have to take a supplement-wise is B12. And that's not because B12 is made, by animals. It's made by bacteria. And bacteria is in the soil. Animals eat the soil. We eat the animal. And so you'd have to take a little bit of B12, but that's really the only thing you'd need supplement. So there are a few folks that we know of that are more plant predominant in their daily life, including some high endurance athletes like Novak Djokovic and Venus Williams. Venus Williams has Sjogren's syndrome, which is an autoimmune disease. And she said this type of lifestyle really is what helped her manage her disease without medication. Chris Paul from the Spurs, right? He said he credits the change in lifestyle to increased energy, mood levels, and recovery time. Kyrie Irving, Alex Morgan from the U.S. national women's team. Carl Lewis, our track star, he said the best year of track competition was the first year he ate this way. Martina Navratilova. There's our old friend, Justin Fields. He said, more than anything, I just love the way my stomach feels and how much more energy I always feel like I have. I wake up easier with lots of energy, which tells me I'm sleeping better, just by a change in his diet. So is it okay to eat this way? Are you going to get everything you need? Yes, you will. The Academy of Nutrition and Dietetics say that a properly planned diet like this is nutritionally adequate, can offer long-term benefits like improving several health outcomes, like we mentioned. And if there still is any doubt as, well, is this really real? Can this really happen? Well, you can ask people around this world, right, around the world. These are the blue zones, and you may have heard of blue zones. Blue zones are areas in the world where people are living a lot longer than we are. And they studied them as to why that is. Well, it turns out they're eating mostly a plant-based diet. They have strong social connections, strong sense of community, strong sense of worth, and they know their why. They also surround themselves in a healthy social circle. They put movement into their daily life. They're always doing something with movement to keep their bodies going. And they also tend to eat or stop eating when they're about 80% full, interestingly. So they don't eat till their stomachs are distended and they want to go lay down because they're too tired. They eat to where they're happy and content, but about 80% full. That's one of their secrets. So you could read about the blue zones. There's a lot of information on that. I want to shift gears just a little bit towards the end here, talk about social connection. So that's important, more important than I think we even realize. But having a strong social connection, the definition here, you could, very subjective definitions, but one definition here is a person's subjective sense of having close, positively experienced relationships with others in the social world. But being socially isolated or feeling lonely is not good. U.S. Surgeon General here came out with this report and looked at how are we doing in the country in terms of connectivity. And most of these lines are all going down. Social engagement with family, non-household social engagement, loneliness, companionship, social isolation. These were going in the wrong direction, and this was before COVID. This was even done before COVID. So even if we get back to where we were after COVID and everybody is back together and mingling, that we're still not where we should be. The lack of social connection impacts our health and longevity. And where do you think it ranks on this list of being lonely, smoking cigarettes, excessive alcohol, overweight, lack of exercise, air pollution? Where does it rank on the list of impactfulness to our health? It's actually number 1. The lack of social connection is as dangerous as smoking 15 cigarettes a day in terms of your odds of mortality. Quite impactful. Only about 39% of us feel very connected to others. About 50% of us report loneliness. It's more widespread than smoking, diabetes, obesity. And interestingly, only 20% of people who feel this way even recognize it as a problem. But it is a problem for them, but they may not even have an awareness of it. But there is increased risk of premature death, as we stated. About a 30% increased risk of heart attacks and strokes, not to mention the other types of risk with that, including mental health, anxiety, depression, and even dementia. A couple of words about sleep. Everyone knows sleep is important, that it has an impact on 3 basic areas of learning and memory, including acquisition of knowledge, consolidation, and recall. So we know it's important. But what about other things than just our memories and recalling information? Decision-making, reaction time, our mood, our judgment. If we're not sleeping well, we may be less likely to make healthier habits, healthier choices for eating. We're probably a lot less likely to be socially engaged with others, which of course is very impactful, as we just saw. And that can lead to high blood pressure, diabetes, heart disease, obesity, and ultimately affect total mortality risk. Here are a few ways just to think about if this is something that you're struggling with, ways to help regulate your circadian rhythm. Going outside within the first half hour to an hour of waking up to get sunlight. Establishing regular sleep cycles, trying to go to bed and wake up around the same time. If you start to feel tired, instead of fighting through it, you try to go to bed if possible. Avoiding caffeine. So the metabolism of caffeine varies in us quite a lot. So for some people, it lasts a lot longer. So they say try not to have caffeine within about 10 to 12 hours of bedtime. And avoidance of alcohol within 3 hours will help too. Daily exercise will help. Of course, not right before you go to sleep. Cool temperature in the bedroom, as dark as possible. And avoidance of the blue lights, right? The blue lights that are on all of our screens, those digital lights will suppress melatonin, which helps us to go to sleep. Staying hydrated is an important one, because dehydration decreases restorative sleep. Weight reduction, developing a wind-down routine, trying to have a routine where you're not doing something so high stress for a good hour or two before bed is always a good idea. In our very busy lifestyles, that can be a challenge. So the benefits of leading a healthy lifestyle are great, and we didn't have time to go into all of these, of course, but there are many benefits that list here, including your cholesterol levels, heart disease risk, of course, your mental health, type 2 diabetes, and of course, reversal of coronary artery disease. Not just treatment, but reversal of it. So back to our patient here, right? Do you remember Mr. Jones? Do we know the answer to this now? All right. That's right. So eating a healthy diet by far will have the greatest impact of Mr. Jones going forward. So Walter Willett, who is a very famous physician from Harvard, said it here in this paper. The current path leading towards increasing adiposity or being overweight, diabetes, cardiovascular disease, disability, unfit, socially isolated population, stuffed with pills and subjected to frequent palliative procedures. That's the path that we're on. So, right, this is what we see when we're out in our streets, right? So I always tell patients, try to be mindful, right, of the foods you're putting in your body, the foods around you. Yes, it's convenient, and that's part of the problem. The healthy foods aren't as convenient, right? We need something on the go. These are the things that are available to us, and that's part of the issue. But I think we can think of this in a little bit of a different way over time, and I think we should. I think we need novel approaches to how we treat our patients and how we can improve the health of our communities. I think it takes a little bit of a paradigm shift, though, right? We need cooperation from a lot of different people on that one, including government, locally, federally, our neighborhoods, taking into account all of our social determinants of health, right? Those are the things, the conditions that we were born in, we live, we work, we play, we worship, all of those things that affect us in terms of our overall health going forward. So we need to educate clinicians more about this and help people understand how the impact of their health can improve over time, especially as it relates to nutritious food. We need to make it more affordable and more convenient. There is hope, though. The Rockefeller Foundation has put $100 million into this Food is Medicine initiative, which is kind of a buzzword around healthcare systems now. We're trying to make this more of a routine, as food should be thought of as our medicine, not just pills. So they put $100 million to advance this effort in supporting research from the American Heart Association. They've also partnered with Department of Health and Human Services to help speed up the integration of food as medicine into healthcare systems. So there is hope. Lifestyle medicine programs are starting to occur in healthcare systems. And we're trying to do this ourselves, actually, because we feel it's real important. And one of the models is taking small groups of patients together, putting them together to put them through a regimented program, a curriculum of educational resources, a multidisciplinary team of people to help them, including coaches and dietitians, doing group activities together, because that's an important part of it, being together and that connectivity, the socialism of it, stress management component, exercise, and something called culinary medicine, which is really that food is medicine component. So this is something that a lot of healthcare systems are doing, is that they're actually bringing patients in, like they do here, modeling what they do here at Science of Spirituality, helping them learn practical tools of how to cook in a different way and in a healthier way. Because that is, as we know, a big barrier, is how do we do it? We're not taught, right? Unless you're taught, you don't always know. So the concepts of a lifestyle medicine team: we create positive environment, we promote healthy habits, personally try to practice healthy lifestyle behaviors ourselves. Parts of the team are clinicians that are more acting as coaches rather than people up there telling you, do this, do that, and take this, and I'll see you back in a few months. This is more of a partnership, multi-directional learning, educational environment, trust between patients and providers, support from a multidisciplinary team, including loved ones and community. We use challenges to look for learning opportunities to help with behavioral change, right? Because this is not a linear road to success, right? This is a journey to success for health. So it's a lot of ups and downs, but any progress is better than no progress, right? So we should celebrate that. Here's that slide again. So I just want to come back to that to remind everybody of the concept here, right? Is we need to look at that faucet because we're really good at sick care. We're really good at that, but we're not as good as well care. We need to be better at well care and promoting healthy preventative strategies. But a positive way to look at this, right, is that we have more control over our health than what we've come to believe, right? We have the power to change our health trajectory over time. And it starts with our lifestyles, okay? Let food be thy medicine. And I thank you all for your attention here today. Appreciate it. Thank you.